Immediate denture. When it comes in removable treatment plan, you need to identify what kind of case that your patient will fall into, and depends on patient condition. There are many different treatment plans you could set it up. The first thing that you need to identify is whether the prosthesis that you're planning to restore will be used as interim, which will be as a temporary or provisional use, or you're going to make a prosthesis as a permanent use. So this is the first thing that you need to determine whether you are making interim versus permanent. The second, you also need to check whether your case will be immediate or non-immediate. In the case that you are restore any prosthesis immediately, then you need to identify as immediate prosthesis. And also the last thing is depends on how many teeth are missing. It could be partial denture or complete denture. So these could be combination with interim, immediate, partial, or interim, immediate, complete, or permanent, immediate, complete denture, or interim, non-immediate, partial denture. So it could be any combination of these three. When it comes in the immediate, that means when the patient presented with existing teeth, but we identify the teeth are non-restorable due to other pathology. In that case, we plan for extracting maxillary 3 teeth. Now, immediate meaning at the time of teeth remove, meaning on the day of extraction, you already fabricate the prosthesis to deliver, and you are delivering this prosthesis at the same time right after the teeth remove. So this is called immediate restore the function. We call immediate prosthesis. And this is after extraction done and delivery of the denture was performed. So there are a number of advantages on immediate denture. The patient does not have to suffer embarrassment of being edentulous. So it's aesthetically pleasing or it's aesthetically advantage. Patient can quickly resume most duty and social contacts, mean they don't need to be stay at home due to the edentulous, so that their masticatory function will be restored back to immediately after the teeth removed. Denture act as a sprint, control bleeding, and also it helped healing. And there's usually better ridge formation when you deliver the prosthesis on the same day. And also immediate denture, you could have a teeth present condition. You could see that patient still has existing teeth, and teeth position could be duplicated because patient compared to fully dentures, then you don't have any reference about the teeth position, teeth shape. But immediate case, patient still present with a few teeth remaining or all, and you could duplicate the position. And also vertical dimension is usually duplicated because existing teeth, meaning there are vertical stop, which is a vertical dimension, are still present with the patient. So it could be used, and the jaw relationship could be duplicated on immediate case. But there's also a disadvantage making immediate prosthesis. Correction of the fit and occlusion is needed at frequent interval. That means once you deliver immediate prosthesis, it requires more visit for adjustment, and therefore it's a higher fee in total. And also arrangement of anterior teeth cannot be evaluated until the denture are inserted. meaning since the patient still present have existing anterior teeth, you cannot actually try it in the anterior teeth before you fabricate the final prosthesis. And it's more difficult to make impression with the correct extension due to the present existing teeth and existing alveolus, which will make tissue undercut, and therefore it's more difficult to take good extension onto the border. Existing teeth may not be in correct centric relation and vertical dimension, meaning when although patient still have a few remaining teeth, if the teeth are extruded or the teeth has mobility 3 or greater, in those conditions, the position may not be in the correct, and also the vertical dimension may be collapsed although there's some teeth are present. And recall, maintenance, and reline are mandatory because after the teeth removed, the tissue going through the resorption and remodeling process. That means between the prosthesis and the tissue will creating the gap over the time. Therefore, the reline are mandatory. And this reline procedure will be additional fee. So its cost will be also higher. So these are the disadvantage in immediate prosthesis. In the past, conventional immediate denture require multiple visits. So these are the sample of preliminary impression, custom tray border molding, doing the wax trim phase, and do the tryin and flasking making denture. So these are the conventional prosthesis fabrication method. When it comes to the immediate denture digitally, the step will be shortened in 3. At first, we are going to make intraoral scanning. And then second, we'll fabricate the tryin denture, which is printed. And we are going to deliver this tryin denture. And then last, before you make the final prosthesis, we're gonna take the wash impression using the tryin denture, and then rescan the new surface after tissue heal, and then we're going to deliver and make the immediate denture. So let's go to the step by step. First thing, intraoral scanning. Instead of taking conventional custom tray and PVS impression, we are going to do the scanning intraorally. We teach the preclinic how to do the scanning, and that's you guys will learn during the preclinical course. It's the same in the clinic that you're gonna use the same machine, and we are scanning intraorally for the immediate case. When you scan partially or fully edentulous arch, you need to follow the very specific sequence to accomplish the good scanning. For the maxillary scanning, you start from the tuberosity to the other side of tuberosity. So start from the one side of the tuberosity, you scan following the center of the arch and the other side of tuberosity. The second, once you finish the arch scanning, then start from the center anterior and then use the zigzag motion to scan the palate. So that will be the second sequence. And once you complete the palatal scanning, then the last one is the buccal vestibule scanning. So from the one side, you need to pull the cheek out and then scan the buccal vestibule area and move around the anterior. Make sure when you scan the anterior portion, you gotta scan the teeth first or center of the arch first and then rotate it in a way to scan the vestibule. And continue on to the other side of the buccal vestibule And that's how you scan the maxillary partial or fully edentulous arch scanning. For the mandibular arch scanning, it's a different sequence. Since there's no palate on the mandibular arch, you're going to start with the left side lingual, and by a slight rotating to the buccal, you swing lingual buccal, lingual side buccal. So left side lingual and buccal, and complete one side arch first, and then move on to the right side lingual, as you see in this picture. And then last one will be right side buccal. And this, following this sequence, you minimize the revisiting the same area and efficiently scan mandibular arch. The last one for the intraoral scanning will be the bite registration scan. You only need to scan from the 6 to 11 facial surface covering maxillary mandibular teeth together. The scanner will orient maxillary mandibular arch scanning correctly according to your bite registration scan. And this will be completion of intraoral scanning for any removable prosthesis. Now the next step is you are going to design immediate case. You are starting with a new case, uploading maxillary mandibular and bite STL file. Then you enter the patient information, starting from the patient initial, patient axiom number, and patient information will be registered. And also there are several options to choose: mold, shape, arrangement, and crossbite if it's desired, and festooning style and post-stem height. So you select the information. Now you're going to start from the matching and maxillary matching, mandibular matching. And then second step is the trimming. And you trim the maxillary arch, and you trimming mandibular arch. And then finding the landmark and verifying all the setup, including occlusal plane. And this is adjustment of ideal occlusal plane. You could change the midline, you could change the angulation. Then the teeth setup will shows up, and you need to change the teeth as you desire if you want to change any tooth or entire teeth as a group. And you also could adjust the vertical dimension by checking the vertical dimension mark, and also you could delete the teeth, either premolar or molar, depends on the case. And it will generate the STL file for us to print to make a denture. Now, maxillary immediate denture case, as you've seen, there's teeth still remaining because when you're scanning, teeth has not been removed yet. So when it comes to the Denka design, first thing is you need to remove the teeth by identify extracting teeth. So this is after you remove the teeth for digitally, and the remaining matching and trimming and landmark are all same. So teeth been already removed, and trimming and landmark, and will confirm all the information that you need to put. and also the teeth final setup confirmation. Again, you could customize any teeth that you desire. So once you complete the designing, now you got the STL file. Now we're gonna print the tryin denture. So tryin dentures, the only difference between the final one is these are in one piece, and also the teeth color only present, not the gum color. And once you get the tryin, now is tryin delivery on extraction day. In certain case, you could customize this tryin by painting pink color as is shown in the screen. Stain the tryin denture before the delivery. So this particular patient, treatment plan for interim immediate complete denture. So that we start with intraoral scanning. So still, as you see, the teeth that plan for extraction is still there when you're scanning for the maxilla. And once you complete the intraoral scanning, patient will get the schedule of extraction and delivery appointment. Now, you got the design complete, and this is a tryin printed. And as we planned, we're going to deliver this tryin denture on the right after the teeth remove. So patient got the extraction done in the morning, and patient came back to the clinic of removable. Now we are going to deliver this tryin, and patient will wear this tryin denture for about a month for doing the tissue healing. So this is delivery of the tryin denture, and we are checking the bite. When case the maxillary mandibular, both arch immediate case, patient got maxillary mandibular teeth removed, and we are going to deliver maxillary mandibular tryin denture after teeth extraction. You may need some adjustment on delivery if there's some tissue undercut. And after you deliver the denture, you also need to check the occlusion as is shown here. Printed tryin denture, this is the same material, polymethyl methacrylate material as a finer denture. And you use this tryin denture to evaluate aesthetic and establish occlusion, so patient actually be able to chew on this tryin denture. And therefore, you could literally testing the finer denture before you fabricate the denture. And in case that you need to adjust or change any position, you could do so, and before you making finer denture. And we are going to take the wash impression before we fabricate the final denture. So this is patient who wear this tryin denture about a month. Now we are going to use the PBS to take the photo molding and the wash impression. And this is after we took the wash impression and on the tryin. And we are going to scan this PBS wash impression, then the final restoration will have the same surface. Heavy body border molding first on tryin, and light body finer impression. And this is how it should look like. And then we're gonna scan this new wash surface, and we're gonna use this new wash surface to fabricate the finer denture. So this is the tryin, and the right side is after we get the wash impression with the border molding. And we scan this one, and we're gonna use this new healed surface when we fabricate the final denture. Now we export that new surface and then put it into the design software and to generate the final denture. Final denture also printed, the teeth and base printed separately and is assembled it together. And this picture is showing after it's assembled it and glue it together. Once its teeth base are glued together, this denture become one chemical bonding, so the teeth and base will not separate after it's assembled. This gentleman need to have plan for immediate denture maxillary, and we deliver the final immediate denture as a plan. And this is how he explained about his.
Diferente. Se mira diferente, abuelito. Sí, le dije gracias. Gracias a David Hernández. Yes. So he was just saying that he was embarrassed before for a while because he couldn't smile or laugh because of his teeth. So afterwards, he says he has much more confidence. And when he went to pick up his granddaughters to school, they commented and they said he looked very young. Great granddaughters. Great granddaughters.
Wow. So another patient that is planned for maxillary mandibular immediate denture, and as seen, the patient are resistant to smile. We are going to scan the maxillary and mandibular arch, and you got the scan finer file, maxillary and mandibular. Teeth designing. First, you're going to remove the teeth, and because it's immediate denture, and we set up the teeth, and this is how the finer teeth position digitally, and we design it, and we got the STL file, and now it's ready to print it. And this is after we deliver the denture. So as you notice, its immediate denture served quite well because the patient's smile changed dramatically. This gentleman came into our student clinic, and as you've seen on the right side radiograph, and you can see that all the teeth are literally floating. So its teeth has mobility greater than 3. And let's take a look at what's the condition he has.
Retract the mouth. Yeah, with the metal. Like that.
Okay.
And just the lower first. There we go. And upper. Retract up further a little bit. Thank you. And in the middle. Close. Tight. You take it out.
What do you say?
So can you tell me about the floss that you have on the bottom?
Oh no, I just keep it because to make my thing stronger, like a bundle. That's it.
Who did it?
I did.
When did you have that one?
It was just an idea.
When did you make that one?
Maybe sometime last year, maybe.
Last year, so
Yeah.
about a year ago?
Yeah.
Okay.
To make it stronger, my teeth, because there was like gaps. Yeah,
Okay.
or structural integrity.
So in this particular case, it's impossible to take in any kind of impression because it will pull the teeth out. So what, as we discussed,
Close, right? You take it out.
we're gonna intraorally scan first. And digitally design. And after teeth remove, we're going to deliver tryin denture first.
Okay.
Very good.
Okay.
If we give it to him, yeah, he could do that one. That's fine.
Okay.
How do you feel? Feeling good?
Snuggly.
So tell me about the extraction.
Extraction
Yeah.
actually was very painful, but I knew that I needed it to to move on forward. They did a very good job, especially Tiffany, and I couldn't tell the doctor's name. Anyways, it was something I had to do, basically. Yes. You got to go smile like a dog. If you have dogs to smile. You know, dogs. I have dogs to smile. I have two pit bulls and one dog.
Yeah, that's
Those
right.
two pit bulls like to smile.
And your wife said that's to the finer teeth?
Yeah. She actually said, "Okay, you really looks good on you." That's what she said. She was surprised.
So we deliver the tryin. Patient will wear this tryin denture for about a month for the tissue healing. And then we're gonna take the wash impression before to make the final denture. And this is the final denture, we made it. And we're going to deliver final denture.
Okay. Other one. And you put these in, okay? The new ones.
And I dropped it off. I haven't. Wow, I feel really good. My God, heaven, I mean, it's so natural. I'm not kidding, it's beautiful. I like it. I really like it. It's like it's natural. I don't have any resistance, nothing, just the friction. It's just like, it's just placed there right. It's so comfortable. I love it.
All right, so that's how we fabricate immediate denture digitally.